Hello, and welcome to our 2023 Legislative Preview. I'm Marty Ranowski, CEO of the Pennsylvania Medical Society. And with me today is Dave Thompson, our Senior Director of Government Relations. Dave, thanks for joining me today.
You're welcome. Thank you.
Before we jump into 2023, I'd really like to talk about this last legislative session in 21 and 22. PA Med had a lot of positive impacts on legislation and really pieces that help move care forward. Can you talk a little bit about that to our audience?
Sure. This year saw final passage of prior authorization reform, something we have been working on for 6 or 7 years now. So we are extraordinarily happy that that bill has finally crossed the finish line. Suffice to say, we'll have to wait and see how things, kind of roll out from the passage of the bill with some regulations that will be needed, et cetera. But we're very happy that it finally passed. It passed with a huge effort from PA Med and our member physicians, but also from patient advocacy organizations and other provider organizations. So we're very, very pleased about that. This year, we also saw the passage of a budget that included a significant increase in the loan forgiveness line item. So Pennsylvania has a loan forgiveness program for residents who are going to practice in rural or underserved areas of the state, and it provides now another $4 million for that program, which is pretty significant.
It is significant.
We also saw passage of IMG legislation. International medical graduates now have license parity to their counterparts here in the United States and Canada. So international medical graduate now only has to complete 2 years of residency training before they can apply for a license, whereas before they needed to complete 3 years. So that is an improvement. We also saw some changes to ancillary surgical facilities. There was an expansion of the procedures that are able to be done in those facilities that otherwise would have previously needed waivers from the Department of Health. All very positive things for practicing physicians here in Pennsylvania. The last thing I'll mention is 2021-22 session, we did not see any expansion of scope of practice legislation, which our members care a lot about, whether it's nurse practitioners, physical therapists, physician assistants, et cetera, psychologists. None of those individuals were able to move forward any legislation that would have expanded their scope of practice. So that is another, success here at PA Med.
Thank you for that update. And really, these are significant pieces. Like you said, with the ASCs, that's expansion of care. With IMGs, they're getting into the workforce quicker. So these are having real positive impacts on our, 12.8 million citizens in Pennsylvania. But let's start talking a little bit about 2023. Roughly a month ago, we just had the election, and there's going to be a lot of changes coming with that. We'll have a new governor, we'll have new leadership in the Senate, and potentially a significant change in the House. Can you talk about really what's happening at the Capitol right now?
Good question. It is something I've never experienced before. It is a lot of change here in Pennsylvania. As you mentioned, we have a new governor that's a Democrat. We have a Senate that remains in control by the Republicans. But in the House, there's a lot of changes going on. At this present time, we don't know who is going to be the majority party come the first of the year in 2023. And I'm not sure that we're going to know that until maybe the first or second week in January. There's also, in addition to who's going to control the House, there's also a lot of questions about who's going to be chairs and committee members of some key committees of ours. We have a number of committees we watch very carefully, whether it's insurance, professional licensure, or health. Right now, because of the potential change of power in the House, we don't know who's going to be chairing those committees, and we don't know who's going to be members of those committees. So until all that kind of shakes out in the first part of the year, things are going to be a little unbalanced, and I think everyone's waiting to see how the dust settles.
So even though a lot of people are focusing on the House, we're seeing changes in leadership at the Senate level
Correct.
as well.
Yeah, we saw the retirement of President Pro Tem Jake Corman. A number of other individuals retired from the state Senate, and 1 or 2 lost their elections. And the same with the House. We saw a fair number of retirements in the House. So we have a lot of new leaders in the Senate, a whole new leadership team. The Democrat leadership remains pretty much the same as it was last session. And we're going to see changes, no matter who's in power in the House, we're going to see changes in leadership on the Republican side for sure, and maybe some changes in the Democrat side as well.
So it sounds like you and your team are going to have to do a lot of education, with new committee chairs, what's important, but with all these new folks coming in, who PA Med is and what's going on. So with that being said, what are some of the top early priorities you're going to talk about to these legislators?
Well, it's challenging for sure, because we are going to have 30 plus new members of the legislature. And these are individuals who really don't know what PA Med is and what we're about. So clearly, we have our job cut out for us with respect to educating those individuals about who we are and what we do and the issues we have concerns about. When I look right now to 2023, until the Board of Trustees prioritizes our legislative agenda, there's a number of things that come to mind. And I'll just tick off a few of the top ones.
Sure, thanks.
Credentialing legislation. Something we had explored a number of years ago. We are going to revisit that this coming session. The time it takes to get a physician credentialed with a health insurer is just ridiculous and unacceptable. The other thing we're looking at is non-compete clauses in physician contracts. Clearly, physicians who are employed by hospitals or health systems have frustrations that they don't have portability. They can't leave one hospital to go with another system because of a restricted covenant. Similarly, we've got physicians who are in private practice that want some of those same protections so that their practices aren't poached by hospitals.
Absolutely.
So what we're going to be doing is looking at that issue, trying to draft legislation that kind of addresses both sides of that issue. Telemedicine, an issue that has been ongoing for the last 6 or so years. We're trying to get it across the finish line. We've gotten it across twice before. The governor vetoed it. So we're going to try another stab at establishing a statutory framework for telemedicine here in Pennsylvania. Last thing, scope of practice. Nothing happened this past legislative session, but for sure we're going to be looking to next session. The nurses will come back and want independent practice, and other medical providers are going to want to increase their scope of practice as well. So scope of practice is the perennial issue that we'll be once again dealing with next year.
And again, this is a bit of a hypothetical because, as you said, we're not going to know who the majority is in the House for a little bit yet. But given these issues, and these really are patient-centric issues, how does Zach and Wayne deal with a potentially divided legislature? How do you get a message across that can bridge both parties?
You know what? We work very well with both parties, and we have done that for years. PA Med is not a partisan organization. We do not necessarily support Republicans over Democrats or vice versa. We work with both sides, and we have garnered relationships, very good relationships with both sides. And in fact, starting a few years ago, we started to garner some more relationships with the current individuals who are going to be heading the House if it's democratically controlled. So we've established some relationships just in the last couple of years with some of those leaders. But it is challenging. There's no question about it.
Well, I want to say thank you, first of all, for the 2021-22 legislative session. You and your team did a phenomenal job. I know the start of 23 will be a kind of fog until we see how everything settles out, but I look forward to the efforts. And again, everything you talked about, it's patient-centric. It's helping our physicians get back to the art of medicine and really treating their patients. So I want to thank you and your team for all your efforts.
Sure. You're welcome.
And I would like to thank all of you for joining us today to talk about the 2023 legislative preview. Please stay tuned and look for more information on our legislative agendas, as well as our 175th anniversary coming up in 2023. Thank you for what you do every day on behalf of the 12.8 million Pennsylvanians who are your patients and rely on you. Have a great day.